Okay, let's get into it. Today we're looking at something fundamental for health. Cholesterol blood tests. We're using a really helpful guide here aimed at folks in Milton Keynes, but honestly, the info applies pretty much everywhere. It's from Blood Test UK.
That's right. And our goal today isn't just to talk about good and bad cholesterol again. It's more about pulling out the really practical stuff from this Blood Test UK guide.
Yeah.
What numbers matter and what's the biggest win for you in getting this test done.
Exactly. This test, the lipid panel, it's like a little window looking straight at your heart health. It's not just about fat, it's about how these fatty bits are moving around in your blood.
Mm-hmm. And there are four main things they measure. You've got total cholesterol, which is, the total. But the guide actually points out that sometimes the balance between the numbers is more important than just the total figure itself.
Oh, that's interesting. Balance, not just a single high number.
Right.
Okay, so what are the pieces then? LDL gets talked about a lot.
Yeah, LDL. That's low-density lipoprotein. People call it the bad one. And basically, high levels of this are what can build up, like sticky stuff, inside your arteries.
Right.
Makes it harder for blood to flow.
Okay, the clogger. And then there's HDL.
HDL, yeah. High-density lipoprotein, that's the good one. Think of it like a little vacuum cleaner. It helps grab extra cholesterol and takes it back to the liver to be removed, cleans things
A
up.
cleaner, I like that. Simple. And the guide mentions a fourth one, triglycerides. People get confused by this one, right?
They really do. Triglycerides are a type of fat, yes, used for energy. But here's the key thing. The Blood Test UK sources stress. High levels often shoot up not just from eating fatty foods, but from too much sugar, white bread, pasta, that kind of thing, and alcohol too. So the test kind of checks your overall metabolism, not just fat intake.
Right, that makes sense. So thinking big picture, why bother? What's the main benefit of actually doing this test?
Protection, that's the word. The huge benefit is getting usable information early on. The guide is clear. Knowing your numbers, especially if your LDL is creeping up, say, over what they suggest is a risk threshold, maybe like 3.0 millimol, lets you act before there's a serious problem. You can make changes, maybe lifestyle, maybe medication if needed, and potentially stop things like heart attacks or strokes way down the line. It's about taking control.
Taking control through local action. So bringing it back to Milton Keynes, if someone listening is there, how do they actually get this test? The Blood Test UK guide gives options, yeah.
Absolutely. It lists three main ways. First, your local GP. Super convenient, usually free through the NHS. That's probably the first stop for many.
Makes sense. Option 2.
Private clinics. The big advantage here is speed. If you need results fast, sometimes you can get them in just like 1 or 2 days.
Okay, GP for convenience, private for speed. And the third?
NHS walk-in centers? Good, because you don't necessarily need an appointment. Just turn up. Quick access in theory.
Okay, but quick access. Does the guide mention any downsides? I seem to recall something about walk-ins, maybe prioritizing urgent stuff. Could a GP appointment actually be quicker for a routine check like this?
That's a really sharp point. Yes, the guide does sort of hint at that. While walk-ins are accessible without booking, you might end up waiting longer if they're busy with more urgent cases. So yeah, booking with your GP might be more efficient if it's just a routine screening. Depends on your situation, really.
Good clarification. And the guide had this great little story from Milton Keynes. Someone actually used their test results.
Oh yeah, the patient who lowered their LDL from high risk right down to a healthy level.
That's the one. And they did it just by eating more fiber like oats and beans and starting a daily walk, just 30 minutes. It really shows how these simple changes, guided by the test results, can make a massive difference.
It totally does. And that links back to how often you should get tested. The Blood Test UK guide suggests for most healthy adults over 40, maybe every 4 to 6 years is okay. But, and this is important, if you have other risk factors, things like diabetes, high blood pressure, or heart disease runs in your family, then it's probably best to check every year. Stay ahead of.
So it's personal. Okay, let's wrap this up. What this deep dive shows, drawing from Blood Test UK, is that simple steps work. Cutting back sugary drinks to help triglycerides, eating more fiber for LDL, it makes you think, doesn't it? What one small thing could you start doing this week that your next cholesterol test might actually pick up as an improvement?
That's the key question. And just remember, all these insights from understanding HDL as the cleaner to finding the best test spot in Milton Keynes for you came directly from that helpful guide put together by Blood Test UK. Worth checking out.